Hello, thanks for joining us again today. I'm going to give you the usual daily update. The total number of positive cases reported yesterday was 498. That's 3.1% of the total number of tests. The overall number of confirmed cases is therefore now 204,553. Of those new cases, 157 were in the Greater Glasgow and Clyde area, 107 in Lanarkshire and 73 in Lothian. The remaining cases are spread across 9 other health board areas. 666 people are currently in hospital, which is 52 less than yesterday, and 64 people are in intensive care. That is 3 fewer than yesterday. I'm sorry to report that 11 additional deaths were registered in the past 24 hours, which takes the total number of deaths under this daily measurement to 7,409. And obviously every single one of those deaths is a tragedy, and I want to send again my condolences to all those who have lost a loved one. As you can see, I'm joined today by the National Clinical Director, who'll help me answer questions shortly. Before that, though, there are a couple of issues I want to cover. The first is just to update you on the progress of the vaccination programme. As of 8:30 this morning, 1,717,672 people have received the first dose of the vaccine. That's an increase of 29,064 since yesterday. In addition, 8,139 people received a second dose yesterday, and that brings the total number of second doses now administered to 108,197. Now, it's worth noting that from today, Public Health Scotland will publish a breakdown of that figure showing the numbers of people who've had the second dose by age, sex and location. But I can confirm that 96% of people in the 65 to 69-year-old age group have now received the first dose, and so have 39% of 60 to 64-year-olds, 33% of 55 to 59-year-olds, and 27% of 50 to 54-year-olds. As I indicated previously, we might face some supply issues next week which could affect vaccination appointments, but we are working hard to try to avoid that. And we still expect, and indeed we are on track, to have offered the first dose of the vaccine to everybody over 50 years of age and to unpaid carers and to all adults of whatever age with particular underlying health conditions by the middle of April. The good progress of the vaccination programme and also the declining number of people catching or falling seriously ill with COVID should give us all real encouragement just now that greater normality is firmly on the horizon. Indeed, and I'll say more about this on Tuesday in Parliament next week, but I am hopeful that next week we might be able to make some relatively minor but I think important changes to the rules around our ability to meet people outdoors, and also to how young people are able to interact with their friends outdoors. I think it's really important, and Jason will say a bit about this in a moment, that we don't get carried away yet. The overall stay-at-home message needs to stay for a bit longer so that we don't send our progress into reverse. But I'm very keen that within that, if we can, then we should all get a bit more opportunity to see loved ones as the first steps we take out of this lockdown. Now, the second point I want to highlight relates to testing. Since the start of the year, we've continued to expand the number of COVID tests we are making available to people working in key public services. Regular asymptomatic testing is now also available at certain food production and food processing businesses, places like dairies, abattoirs and meat and seafood processing plants. These are settings that we know, and indeed have had some experience of this, present a higher risk of transmission due to factors like low temperatures, high humidity and limited ventilation. So we've extended testing to these kinds of businesses in order to try to minimise the risk of outbreaks in them. Under the scheme, eligible businesses are provided with free lateral flow tests. These tests allow workers to see their results very quickly within 45 minutes of the test being administered. But as you've heard us reflect on here before, lateral flow tests are less sensitive than standard PCR tests. And so for anybody who tests positive through a lateral flow test, the advice is to have that followed up and confirmed by a PCR test. The testing on offer, of course, is voluntary for businesses and staff. However, a growing number of businesses are now signing up, and I would strongly encourage others that are eligible to do the same. If you want to find out more about whether or not your business is eligible, you can find details or you can get details by contacting food supply information at gov.scot. That's food supply information at gov.scot. Regular testing is an important tool to help identify positive cases. So by taking part in this scheme, food businesses are helping obviously to protect their workers and to prevent outbreaks and minimise the risk of closure, but they're also helping to minimise the risk of any cases or outbreaks in their premises spreading into the wider community. And that's obviously good for everyone, helping businesses to stay open, but also giving everybody an added degree of protection. Those are the 2 points I wanted to highlight today. Before I close, though, and hand over to Jason, I will just stress again the current rules and guidelines. For now, the most important rule of all for all of us is to stay at home except for essential purposes. Don't meet up with other households indoors, and if you are meeting up with others outdoors, for now, please only meet with one other person from one other household. Continue to work from home if you can, and as an employer, if that is the situation you're in, remember to support. You have a duty to support your workers to work from home. And if you are out and about, please continue to follow all of the vital facts advice. Make sure you're wearing your face covering, make sure you're staying away from crowded places, clean hands and surfaces, 2 metres distancing for anybody that you're coming into contact with, and self-isolate and get tested if you have symptoms. We all stick with this right now. I'm really, really optimistic at the moment that we will continue to see the progress that we need to see to start opening things up and getting us all back to much more normality. Jason and I were just reflecting before we came in here. The last time we saw case numbers and such like, and Jason may say more about the overall picture here, was round about September, October. But we also know then just how quickly things started to go in the wrong direction again. So it's really important that we stick with it for now, hold our nerve, keep suppressing cases while vaccination does its job. And if we do all of that, we can be really hopeful that there are definitely, at long last, better days lying ahead. Thanks for listening. Jason's going to say a few words and then we'll take questions as normal.
Thank you, First Minister. So the World Health Organization say that you should look at 4 baskets of measures around whether you have COVID-19 and the pandemic under control in your section of the world. Cases, positivity, hospitalisations, and unfortunately, deaths. So let's quickly look at those 4 elements. And I am hopeful today, more hopeful than I have been for some time. So for cases, we have just dipped underneath an artificial threshold, of course, of 500 positive cases found with testing yesterday and the days preceding. So reporting today. The last time we were at below 500 was at the end of September, just as the First Minister has intimated. Now, it's important to balance that with, we all know what happened from then on. It accelerated very quickly and got out of control fast. We're also around 70 per 100,000 in a 7-day average. Now, you'll remember that data is the way we compare region with region, country with country. And the WHO used that as a threshold measure for control or out of control. So we are around 70 per 100,000, and the last time we were at 70 per 100,000 was the end of September 2020. Remember, in July, we got to 1 per 100,000. 1. The WHO have 2 thresholds where they consider control to be partly true, under 50 and under 20. 12 local authorities yesterday were below 50, 25 local authorities were below 100. Only 2 island communities and perhaps 1 mainland were under 20. So there's still some way to go, but it is very, very encouraging, and it is moving downwards. Positivity, quickly, same story. Below 5 now for a few days. Last time we did that was the end of September. So let's go to hospitalisations. The best way to think of hospitalisations is to try and do over a 7-day period, because hospitalisations are not smooth. So you take a 7-day average of daily admissions, not people who are in already, because they can be in for a variable amount of time. The best measure for us, for this kind of assessment, is what's the pipeline like? How many are coming in with serious disease that requires them to be hospitalised? So the 7-day moving average in the most recent data is 50. So 50 people per day being admitted to hospital in the last 7 days. The last time that was true was the first week in October, 2 weeks after the cases rose. Those of you who have been paying attention will understand exactly that sequence. In the week to the 3rd of March, we had 45 intensive care admissions versus 72 in the previous 7 days. 45 ICU admissions in the week to the 3rd of March, which is considerably lower than the 72 in the week before. And if you do that for hospital admissions, you get 350 in the 7-day period most recently versus 542 in the previous 7 days. So hospitalisations beginning to reduce, and reducing fairly quickly. Now that may be a number of things. It's of course lockdown and your work, but it's also the beginnings of vaccination. It's vaccination in younger age groups who are mixing more than those who we started with in care homes, beginning to show through in the hospitalisation data. We don't know that for sure, but the research suggests that's true. And then finally, mortality, deaths. So again, the 7-day average, so the average over a 7-day period to smooth out variation. The 7-day moving average for number of deaths with the 28-day, within 28 days of a positive test, not the NRS death certificate data, but the daily data you hear the First Minister report is 17. 17 deaths per day in a 7-day period in the last week. The last time that was true in Scotland was the 25th of October 2020, a few weeks after the numbers in hospital and a few weeks after the cases. So all 4 data points moving in the right direction and moving quite quickly in the right direction. Now, just to balance that, the WHO yesterday gave a press conference about Europe, and they don't do that very often. They do that when they have something to tell us. And unfortunately, it was worried. That's how they felt. There's been a 9% increase in cases across Europe in the last week, and that's after 6 weeks of decline. This is the whole of Europe. There were 1 million new cases in Europe in the last 7 days, and half of Europe's countries have increasing rates. We do not. We have decreasing cases, so we're on the right side of that equation, but it should warn us about complacency. They asked for all countries to get back to basics, and they gave 3 pieces of advice. First, increase your vigilance about new variants. Second, roll out your vaccination as fast as you possibly can. And end lockdowns gradually and only when driven by the evidence. Now, you won't be surprised that that's the guidance that we will use in our advice to the First Minister and the decision makers.
Thanks very much, Jason. I hope you found that helpful and interesting. I'll go now to questions. Firstly, Aileen Clark from BBC Scotland.
Good afternoon, First Minister. First of all, can you address the concerns of nurses who say they're being paid a lower rate than other professional groups like GPs and dentists for taking on vaccination shifts and are feeling undervalued as a result of that? And also today, Cyprus are saying from the 1st of May, very happy to receive British holidaymakers if they've had their vaccinations. Could Scots be among those holidaymakers? And if not, then when do you think Scots holidaymakers may be able to head off to the sun?
On the first point, nurses are hugely valued for the work they've done in a whole range of different ways over the pandemic, and obviously those nurses who are assisting with the vaccination programme. In summary, the way healthcare workers who are delivering vaccinations are paid reflects their pay for the job that they do. There has been some change already made with nurses, where nurses, I think, were getting the rate of a band 5, which they would get in a bank nurse, and we've changed that so that they would get the rate they are actually paid for the band that they are at. I said in Parliament, though, I think earlier this week, that this is something I have asked to be looked at just to see whether there's anything more we need to do. I don't want any healthcare worker feeling as if they are not being valued for an incredibly important job that they are doing. On the second question, I like everything else, I want to be able to stand here and say, yep, you can fly off to the sun. But I'm not going to do that before I think there is a degree of certainty that that can be done without risk. And in the scheme of things, and before I say this, I know people will have different views of what matters most to them. And please don't suggest that I'm dismissing the importance of people getting holiday and rest and relaxation, nor am I dismissing, and this point is perhaps even more important, that international travel for some people is not about holidays, it's about visiting family, if they have family who live in other countries. But while I think we can perhaps be hopeful that at some point there may be some kind of certification that allows international travel, similar to yellow fever certificates right now, I think we're still some way away from that, because there's a number of issues that still have to be worked through, both ethically and practically. And I think we've got to be careful that we don't build iniquities into whatever system we use. And for some reasons there will always be a small number of people who can't get this vaccine. So we've got to think about that and make sure if we do go down that road, we do it properly. And the last point is, in terms of international travel, we need to, as Jason has just said there, the biggest risk we face right now is, as we suppress the virus here and as the vaccination programme does its work, we have new variants coming in from elsewhere that then maybe spread more quickly, maybe they are more severe, or the worst of all, they undermine the efficacy of the vaccine. So we really, really need to be careful about this. And while everybody wants international travel restrictions lifted, they are possibly, for this next period, the most important protection we're going to have. And we see how seriously the cases of the new Brazilian variant that we identified through genomic sequencing last weekend are being taken to get a sense of just how important we think that is. So if we want, and you've heard me say over the recent weeks, trade-offs, deciding what really matters most to us is important. If we're going to open up our ability to live more normally at home over the next few weeks, it may be that just for a bit longer, the price of that is continued restrictions on our ability to travel. Do you want to add anything, Jason?
I would love to go to Cyprus on the 1st of May, but on the 5th of March, I can't tell you if it's safe to go to Cyprus on the 1st of May. It's as simple as that. And there are 2 countries involved in that conversation, as well as every other international port that we would want to visit. So we need to remember this is a global pandemic that is not under control. It's not under control in Europe, as I've just described, but it's not under control in almost every region of the world. The Americas is still accelerating beyond anything they've seen previously. So we have to be cautious about rushing to that kind of scenario. I would love to have all of that back. And as soon as the advice is able to be given, we will give it. And then the decision makers can make choices about what comes first, what comes second, and what comes subsequently.
Ross Govins from STV.
First Minister, it would appear that Scotland could be about to miss out on hosting the Euros. Where are your discussions with the SFA at the moment? And is there any realistic prospect that you will be able to give the assurances that UEFA appear to want about allowing at least some fans to attend the matches?
I certainly hope so, and nobody wants Scotland, to use your terminology, to lose the Euros, and I don't think we should be in the position right now of thinking that's the case. There's a deadline by which all countries have to give indications to UEFA about what they think will be possible in terms of fan attendance and fan zones. All countries are grappling with this, not just Scotland. And as Jason has just said there, in relation to international travel, we're standing here on the 5th of March. And while we're really hopeful, and I think you're getting signs of a lot of optimism from us today, looking too far ahead is just difficult to do. But let me be very clear, we are absolutely intent on having the Euros, having Hampden as one of the host stadiums of the Euros. We've always been intent on that. Let's say we're particularly keen on it now that would bring the opportunity to see Scotland play at Hampden as well. So can I say that while nothing in a global pandemic can be certain when you're looking far into the future, I very, 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 very much want hope and hopefully over the next few weeks get a greater degree of confidence in saying expect to be one of many of the Tartan Army fans cheering on Scotland at Hampden later in the year. So let's keep our eyes on that prize. My final point on this, though, is we've all got a part to play in making it possible, because what is necessary, we continue to suppress the virus as we get vaccination the vaccinations rolled out more. So we've all got a part to play right now. Let's stick with it just now so that the Euros and hopefully much more besides becomes possible for us to be enjoying come the summer months.
I agree. I think the First Minister used 4 verys before hope to get this event running properly in Scotland with a crowd. I am equally hopeful that that can happen, but it's the 5th of March. So if you ask me today, can a crowd of X number be in the stadium in June? I simply cannot tell you. I can't give that advice. I don't think anybody can. I know the Spanish authorities, the Irish authorities, and others are struggling with that certainty that some people seek. Now, by the deadline into April, we may well be able to give much more certainty, but there'll still be an unknown. We'll still need the ability to reverse. We have to have that. Every country has to have that. And the 12 countries involved in this complex negotiation and arrangement have to take a view. We will take a view that's the best for the safety of the population in our advice and the hope that we can have these events running safely. The most important point here, though, is the last point the First Minister made. And it goes to the opening of schools, the ability to visit care homes, the ability to have the Euros. The most important thing is to reduce the incidence. And that's up to the Tartan Army and the rest of us. It's everybody's point to get that incidence down, and then we'll be able to have crowds at the Euros at hand.
Let's just say we haven't waited so long to see Scotland play in a major tournament to not do absolutely everything we can to ensure that there are going to be fans there to cheer the team on. Phil McDonald from Global.
Thanks, First Minister. Do you have an update on the number of passengers who've been traced who were on the Heathrow to Aberdeen flight where the Brazilian variant was detected? And do you have any update on whether there is or there has been community transmission? Thank you.
There are still 3 index cases. We've got no further cases identified, which is good. So that would suggest there is no, so far, onward community transmission. As of 9:30 this morning from the flight, 69 individuals had been successfully contacted. Some of them, 13 of them, are no longer in Scotland. The others who are in Scotland have reported no symptoms for themselves or their households. And some of these have reported having received negative test results as part of regular workplace testing. Work is ongoing to contact the remaining passengers. We've established that not all of the data we received was correct. So of the remaining passengers, there are still ongoing attempts to try to contact them. Some telephone numbers are not being answered and others have been found not to be accurate, but that work is ongoing. In terms of the wider efforts, there's more than 223 secondary contacts and additional contacts within healthcare settings have also now been identified. So there's significant work that has been done and remains ongoing, but the really positive thing so far is that there has been no other cases from all of that work identified, which means that so far we don't have evidence of further onward community transmission. Callum Clark from Bauer.
Good afternoon, First Minister. I'm just keen to get your thoughts on the Police Scotland figures which were put out today. It received an additional 25,000 calls in the last year or between April and December, and these include a big rise in public nuisance call-outs, more than doubling to over 123,000. Considering, we're still in lockdown, you're still asking people, the public, to comply with measures. Are you at all disheartened or concerned by these figures?
I think it's probably better for Police Scotland to comment on what they think of those giving their calls to the police. But I wouldn't be, firstly, all that surprised. We're in lockdown. People have been really anxious, if they are abiding by lockdown, to see others do the same. So perhaps people, who witness others that they perceive to be breaching lockdown guidelines think they're doing a civic duty in phoning the police, and if they think there are serious breaches, then they are. But those figures have to be seen in the context of a population of more than 5 million people having been in lockdown on and off for a year. So what that would say to me is, while we don't want these rules to be breached at all, because every time somebody breaches them, they create a risk of the virus spreading. But actually what they would say to you is that the vast majority of people have been abiding by these rules. And I think that's a good thing and a huge sacrifice on the part of the entire country. And for a little bit longer, we need to continue to do it so that we avoid the risk of going backwards when everything else right now suggests that if we stick with it, we'll keep going forwards. And by the summer, we can be perhaps watching Scotland at the Euros, we can be seeing family and friends, we could perhaps be travelling a bit more widely within Scotland, we can have businesses up and running and trading again, and we can all of us have life just feeling, if not 100% normal by then a lot more normal than it has since this time last year. So please, for all these reasons, continue to stick with it. Conor Reardon from PA.
Good afternoon. Could you give us any more idea of what these important changes could be that you're going to announce next week with regards to meeting people?
I'll announce them in Parliament, Conor, for reasons I know you understand. But what I did say is that, and so I'll repeat it again, we've been very clear over the last few weeks that as we come out of this lockdown, it's really important to try and prioritise. We can't do everything at once or we will find ourselves very quickly in a very bad place again with COVID. So we have to be careful, cautious and prioritise what matters. We've prioritised getting kids back to school, which I think most people agree with, getting some visiting back into care homes. And what I'll talk about next week is, can we, given the good progress we're making, without compromising or jeopardising that progress, free up people's ability to see friends and loved ones again? Now, it will be very much focusing on outdoors at this stage. It may not be it's unlikely to be lifting travel restrictions, but maybe just giving people the ability to see more people on an outdoor basis. I'm particularly keen, if we can, that we try to, as fast as we can, bring more normality back to young people, teenagers who are missing seeing friends. Can we allow them to see a bit more of their friends outdoors? So this is work we're doing, looking at the data, looking at the progress, thinking, can we give people just a bit more freedom right now without jeopardising that progress? And I'll set that out on Tuesday. The following week, as has already been scheduled, we'll set out the longer term plan for getting the economy reopened. So giving more certainty around the dates when we'll get shops and perhaps hospitality, gyms, hairdressers, which I am one amongst many desperate for, reopened as well. So, the next few weeks, hopefully the next couple of weeks even, are going to bring, if we continue to stick with it and keep this progress, should bring a lot more, uplifting news for all of us. But we've got to do it carefully. We've got to do it step by step so that we don't, if we try to run before we can walk on this, we will fall flat on our faces and we will end up back in lockdown. So it's really frustrating, but it's the discipline that will determine whether or not by the summer there is much greater normality than there is right now. Conor Matchett from the Scotsman.
Thank you, First Minister. Hopefully you can hear me. Just checking. Yeah. Great. You've actually slightly guessed my next question, which is about young people. I think many young people are worried that as the vaccine rollout continues, they're likely to be the last to see the return of normality, and potentially due to vaccine passport type policies that might see them barred from going on holiday or entering hospitality, or that they'll be forced to work in hospitality without having received a vaccine. Wondering, can you offer any reassurances to young Scots that they'll not be stuck inside their flats come August, still waiting for a vaccine, as their parents' generation is free to go ahead, go on holiday and take advantage of the return of hospitality? And just a second question, if I may. I know in Parliament on Tuesday, you said the target of 400,000 vaccines a week had been exceeded, a claim that was repeated by the Health Secretary on Wednesday. The Scottish Government admitted yesterday that this was in fact incorrect, given the highest weekly total was 392,000, and instead said the government was on course to hit that target before the bad weather of mid-February. Can you explain why you said that target had been exceeded when in fact it hadn't been?
I got it slightly wrong in the heat of answering a question. We did have that week, we had planned, we had appointments booked to meet or slightly exceed that 400,000 target. What happened was the snow meant that the cancellations that came about let us falling slightly under it, so 392,000. So I just misspoke in the moment bit because that's what we had planned. But, 392,000 in a week where we had some of the most severe weather that the country's had in years, I think was a pretty good achievement. But, that's the reason. And in terms of the first question, Jason might want to say a word on this as well. We aim to have the whole adult population vaccinated by the end of July. So that includes young adults, people at the upper end of their teens, early 20s. So that proposition doesn't really arise. I also worry, though, about younger teenagers, the sort of 13, 14, 15-year-olds who've had their lives in the last year just completely turned on their heads. So getting them back to school, opening up the ability for them to have greater normality. And even although they, in the short term, won't be vaccinated, we can all help to create the environment in which their lives can go back to normal as well. So just as right now, staying at home for us is opening the headroom in the virus data to allow them to go back to school, us doing that for a bit longer and all of us getting vaccinated opens up the room for them, even although they're not directly vaccinated, to live more normally as well. So, young people are the priority here, and getting to the normality we want for them might mean doing it in different ways, but I think they should be the priority for all of us right now.
A couple of things to encourage that young person's group, perhaps. So there are ongoing trials of vaccination in younger people, right down to small children, run by higher education institutions in Scotland and around the world with the drug companies. So in time, I would expect we will almost certainly vaccinate children against COVID. It might be round 2 of vaccination, maybe autumn, winter of this year, if all of those trials go well. The second thing is that remember what vaccination is. Vaccination just now is about protecting individuals. Vaccination at scale is about protecting populations. So once we get to 4.5 million people, our population is protected, even the unvaccinated. And it's a very important transition that we will go through as the next few months go past. Initially, when you vaccinate in the care home, you vaccinate the man or the lady to protect them from the disease. Once you vaccinate at the scale of millions of people, you kind of put a buffer around the whole population because it reduces incidence and keeps the virus from having an ability to transmit. The danger there is that you still import new cases. So that's the last thing to go. You've got to be careful about importation. One of the reasons we're thinking very, very carefully about any kind of vaccine certification is exactly the point you raise. And the First Minister's right in an answer earlier that we have to think about the equity of a vaccine certification process. So we have to be careful that we don't exclude sections of society by age, by socio-demographic, by whatever else, in allowing some people to do some stuff and other people not.
Thanks, Jason. Georgina Hayes from The Telegraph.
Just to maybe elaborate on that a little bit. Obviously, as we come out of lockdown, hospitality and areas like that are going to reopen before a lot of young people will be vaccinated. Can you understand concerns that might be raised when that happens and you have 25-year-old people concerned to go to work as we come out of lockdown before they get a vaccine?
Well, that would apply to, and you hear that concern from teachers in schools, but the more people are vaccinated, the more protection there is, and nobody's going back to work during COVID without protections being in place. These are all the things we have to balance up. But all of the adult population by the end of July, supplies permitting here, and I'm assuming we don't get heavy snow again in July, but in Scotland you never know. So all of these things permitting, then by the end of July, everybody in the adult population will have had, I say vaccinated, I've got to be careful there, will have had the first dose of the vaccine. Of course, you need 2 doses before you're fully vaccinated, but we know the first dose is, or we know from research, the first dose is giving quite a significant degree of protection. Georgina Hayes from The Telegraph.
Thank you both and good afternoon. Kind of following on a little bit from what Conor just asked, figures released by your government yesterday show that people who have been vaccinated are socialising more than people who haven't been yet. And as more people in the country do get their jabs, are you concerned about a 2-tier society being created between those who have had a jab and those who haven't? And also, I'm wondering, are you worried about the impact that this might have on transmission of the virus? Thanks.
If people start to socialise before the rules allow them, then yes, there is likely to be an impact on transmission. And I understand that people, when they have their first dose of the vaccine, might feel as if they're a bit more protected. But, you know, you could be socialising with somebody who's not vaccinated. And even if you're socialising only with people who are being vaccinated, remember that the protection doesn't kick in straight away. And although we are increasingly optimistic about the impact on transmission, we don't yet know for sure exactly to what extent the vaccine is stopping people getting or passing on the virus. We do have very strong evidence now that it is reducing the prospects of you becoming very ill or dying from it. So, you know, we have rules in place right now for everybody, not just for people who are not vaccinated. So the stay-at-home rule, all the rules around not having people in your house, only meeting one other person from one other household outdoors, the facts advice, that applies to everybody. And it's really important that we all stick with it, because if we don't, the danger is, like Jason was saying earlier on, some countries across Europe are seeing that cases start to go up again, and then all bets are off and we're starting to have to consider imposing new restrictions. So it's really, really difficult, and I understand that. I'm subject to these restrictions as well. I want nothing more right now than to travel to Ayrshire to see my parents, but I can't do that right now, even although they've been vaccinated, because if we all start easing up too soon, we're going to end up living with these restrictions for much longer. And when we're so close to perhaps getting that normality back, that would be the worst possible thing for us to do. So please continue to stick with it. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. You've talked a lot today about your optimism about some of the figures that you're seeing. Yesterday, Matt Hancock was talking about his optimism that travel between all parts of the UK will be able to go ahead by this summer, and that people will be able to enjoy staycations across the whole of the UK. Do you share his optimism on that? And he had also said that he thought that the English route map and the Scottish route map might be very similar. The English route map sets out that overnight stays can happen as early as April the 12th for people in the same family. Do you think it's possible that around that time might also be possible in Scotland?
I don't know yet, and I'm not going to give an answer to that, because that matters so much to people, and it would be really wrong for me to give an answer ahead of my ability to give a solid answer on that. I'm optimistic about all of these things right now, but I know that the worst thing we could do is move too quickly. You know, we've got some experience from last summer of things we perhaps did a bit too quickly, things that we didn't retain stringent enough rules around, travel being one of them. So we have to be careful that we don't do that again. But if we continue to do this properly, have patience, have a bit of discipline, stick with it, then I'm optimistic that over the period as we go into the summer, lots of these things start to become possible again. Dan Vevers from The Sun.
Good afternoon. Thank you, First Minister. Your party's Westminster leader, Ian Blackford, is reported as saying today an independence referendum could still be held late this year. Now, even if, as we all hope, the immediate health risk from COVID has subsided, would it, in your view, really be appropriate to focus on a referendum, given we would still be emerging and recovering from the pandemic, may still be unable to do things like travel abroad, and may still be required to follow guidance on distancing and face coverings and all the rest of it?
I'm not getting into political questions right now. This is a COVID briefing. I'm going to stick to that today. My focus is on COVID and doing what is right around COVID for as long as it takes. And that's what I'm here to talk about today. Alistair Grant from The Herald.
Hi there, First Minister. Thanks very much. You touched a little bit on vaccine passports earlier. I just wanted to ask about comments by Devi Sridhar, who said earlier this week that vaccine passports are heading this way, and that Scotland needs to be ahead of this and preparing for it. What preparations are taking place in Scotland for vaccine passports coming into play? And do you think there will be a place for domestic passport systems for access into bars and concerts, for example? Thanks.
I don't know yet. Jason may want to say more. What I do know is that Professor Sridhar's expertise and advice, like that of others on our advisory council, will be one of the factors that make sure Scotland is ahead of the game and thinking about all of these things properly. You know, there are some really big issues that we have to think through here. There's some big unanswered questions yet about the impact of the vaccine on transmission, and then there are all of the issues, if we're going down that road, of how it works, how we avoid the inequities, you know, how we make sure we don't disadvantage certain groups and certain people. So, you know, these things are all requiring to be thought through, and that thinking is happening in the Scottish Government, as it is, I'm sure, in governments all over the world.
That's basically the answer. Professor Sridhar was asked at Health and Sport Committee about vaccine certification, and she gave examples from around the world, from her network of academics and others who have looked into this, and gave some examples of where it's not happening and where it potentially is happening. We've heard the Cyprus example already, a vaccine to change behaviour, to allow you to do more things. That has massive implications for your citizens across your country, and therefore we need to think about that very, very carefully in the advice, which will not just be public health advice, it will have to be much broader than that, around society, around ethics, around hospitality and tourism and everything else that would go along with it before that goes to decision makers for decisions. There are things we can do to be ready, and we are starting to have those conversations about a digital solution to whether you've been vaccinated, whether you've been tested, whether you've been in contact with other people. And we can start to build the blocks for that as time passes. But the big decision about what it will mean for Scotland and how we will engage with the rest of the world, we haven't made those decisions yet.
Thanks, Jason. That concludes the questions today. So my thanks to the journalists. Thanks, Anna, for your interpretation, and to Jason for helping me answer the questions. Thanks to all of you. We are in a really good place right now relative to how it's been over the past few months. So we should feel a genuine sense of encouragement and optimism. Cases are falling, illness is falling, deaths are falling, and we've got this vaccination programme really powering ahead. So there's every reason to feel a bit more light about what the future might hold. But we know, and I'm not saying this just because I want to, sort of cast doom on the light I've just spoken about, but we know from experience and we know from how this virus operates. And remember, it's more infectious now than it was last summer, because this new variant now accounts for more than 85% of all cases in Scotland. So most of the COVID in Scotland now is more infectious. So that means we need to be cautious. We need to not get ahead of what the data allows us to do, because the last thing any of us want is to go back the way and have to think about more restrictions, not continued easing of restrictions and that journey back to normality. So that's why we keep saying to you and keep asking you to stick with it. And if we do keep sticking with it, then I do think there's every reason to hope that in the not too distant future, we'll be living a lot more normally and have much more contact with our friends and family, and be able to do some of the things we all enjoy doing. So in the meantime, we'll be back here on Monday. Tuesday, I'll set out hopefully some minor changes that might make everybody's life a little bit easier on Tuesday. And in the meantime, have as good a weekend as is possible in these circumstances, but please continue to stay at home apart from essential purposes. Thank you for listening today, and we'll see you next week.